any more books out there?
We ran out. We'll make sure you get it after the
Do we need
program.
more? Oh, no, after.
Well, we want to get started because of the TV. We need to get started because it's like live on the TV. So I'll do my introduction. Good afternoon, everyone, and good afternoon to anybody who's watching from home. We have a wonderful crowd here in the chapel. Today we have Liz Heath with us. As we all know, Medicare can be very difficult to understand, so Liz is going to help us understand some of those things, and she's going to touch on the changes that are coming up for 2025. Many of you got a handout when you came in the room. If you did not get one, because we had more people than we expected, which is always a wonderful surprise, we'll make sure that you get those handouts at the end. So don't worry, we'll take care of it. Just make sure you come and see us when we're finished, and we can get you all the information that you need. Also, if you have additional questions for Liz, after the program is over, she'll be in the back of the chapel to answer any individual questions that you may not want to ask in front of the group. All right, and with that, I will turn it over to Liz.
Thank you for the introduction. My name is Liz Heath. I'm a licensed insurance broker. I help individuals with their Medicare insurance. I never thought that I would find so much pleasure in helping individuals navigate the complexities of Medicare, but I do. So it's been great. I've been in business for the last 7 years and started as an insurance broker about 9 years ago. But we're not going to talk about me. We're here today to talk about the changes that have come to Medicare for the 2025 election period or season. And it's come about because of the Inflation Reduction Act. Has anyone heard of the Inflation Reduction Act? Okay. So we're going to learn each year there is something that Medicare is doing in regards to the Inflation Reduction Act, and their goal is to help individuals, Medicare individuals, be able to afford their medicines as well, or I should say, so that they can live longer. Who wants to live longer? Does anyone have trouble paying for their medicine at this time? Okay, so we're going to learn what Medicare has done so that we can all afford our medicines and be able to live longer. So you may see my business is Heath Insurance Solutions. However, on this presentation, you'll see that it's done by Medicare Answers Now. All of our presentations have to be approved by CMS. So this just isn't stuff that I made up and just decided to come out today to present. This was approved by Centers for Medicare and Medicaid Services, and Amanda Bruton, who has Medicare Answers Now, she had this approved by CMS so that all of the brokers can be out here in the communities sharing the information. Oh, and I've never used the clicker before, so if I need to move forward, I'm always used to paper. So today I have both the paper format and also on the screen. And if anyone that's watching on TV still wants to come down and to the chapel, we still have seats, so feel free to come down. So in today's agenda, we're going to cover the Inflation Reduction Act. What are those 2025 Part D changes? the Medicare prescription payment plan. We never heard of a payment plan when it came to our prescriptions, so we'll talk about that. The key changes to TROOP. And you may say, what is TROOP? And we're going to learn about that. Medicare has a lot of acronyms. And we're going to learn about credible coverage when you're on group coverage. And again, this today is just to learn about the changes that are coming with the Part D plan of Medicare. However, being a licensed insurance broker, at the end, if there's still time, or out in the hallway, if you have any particular questions, you can come and see me. You also have my telephone number there that you can reach me. I will be coming to Landis Homes on most Wednesdays, so you can just call the number. You'll speak with my assistant, and she could schedule an appointment if you have further questions or wanted someone to review your Medicare plans. So what is the Inflation Reduction Act of 2022? So on August 16, 2022, the Biden administration passed a new law called the Inflation Reduction Act of 2022. This law brings big changes to Medicare Part D, which covers prescription drugs. The changes affect all types of Medicare. So whether you're on a Medicare Advantage prescription drug plan or a group, maybe you still have your plan from your employer, that's a Medicare plan, or whether you're just on a standalone Part D because you use original Medicare and supplement, it's going to affect all Part D plans. So Part D plans including, I got ahead of myself, so there it says, the Part D plans including individual and group plans, as well as the standalone prescription drug plans and Medicare Advantage plans with the drug benefits. And these changes started in 2023 and will continue until 2032. So each year we're going to see changes, but this year is with the prescription drug plans. So let's talk about what those key changes are. And they are effective January 1st. Thank you. Again, this is my first time using this clicker, so I apologize. Thank you. Okay, so let's catch up. Maybe I should get rid of that and we'll do this. Okay. So what are those key changes effective January 1st? Well, we're going to get rid of that prescription drug coverage gap, or known as the donut hole. Does anyone know what the gap or the donut hole of the Part D program is, or what happens at that time? Has anyone been through the gap? Some of you know what that gap is. That's not a good place to be. Medicare for this year, and I'm probably getting ahead of myself again, in prior years, Medicare had the gap. In the gap, you had to pay 25% of the retail cost of the medicine, and not the copay, but 25% of the cost of the 25% of the retail cost of the medicine, and that could be, for some individuals, that was not doable. So this year, for 2025, Medicare for Part D is going to limit the annual out-of-pocket drug costs to $2,000 for people with Medicare Part D. So for your medications, I don't know, I'm not going to ask for a show of hands, but some of you in the past may have been paying more than $2,000 to get your medications in a year's time. That will change for 2025. Something else that we've never heard of. So that gap or that donut hole is going away. That can be a good thing. So something else that we've never heard of coming up for January 1st. Medicare is going to make sure all Medicare Part D plans offer a prescription payment plan option. It was very expensive for individuals in prior years when they got in the gap to afford their co-pays or being in the gap. So this year we'll see that you can have a payment plan option. That's never been a part of the Part D plans in the past. And it requires Part D plans and drug manufacturers to cover more of the drug cost. So what do those plan phases look like for 2025? We're going to have a deductible phase. The deductible this year will be $590 annual deductible. And remember, this is just concerning the drug portion of Medicare, whether you're in a Medicare Advantage prescription drug plan or you're in a standalone prescription drug plan. The insured pays 100% of their gross covered prescription drug costs until the deductible is met. So that's what happens in the deductible phase, but you will pay no more than $590 for a deductible. And that deductible does go towards the max out-of-pocket of $2,000 for the year for your medication cost. Then, after you've met your deductible, you're going to go into the initial coverage phase. In this phase, the member pays up to 25% co-insurance covered Part B drugs. This phase ends when the member has reached the out-of-pocket maximum threshold of $2,000. There used to be a catastrophic phase. I don't know if any of you in past years had gotten to the catastrophic phase. Last year, the Inflation Reduction Act took that away as far as no one person had to pay during that, should they have reached the catastrophic phase. And again, this year going forward, for 2025, the member pays no cost sharing for their covered Part B drugs. So 2025 Medicare Part B. The deductible phase, you are responsible for 100% of your prescription drug costs until your deductible is met, like I had it said in the previous slide. Your plan may have an annual deductible of no more than $590. Plans may vary. And I'm sure everyone's familiar with hearing about tiers that the prescription drugs might be on. Some tiers may not have you pay anything towards the deductible. So each plan is different, but that is why it's very important this year to get your prescription drug plans or your plans checked during the annual enrollment period, which is October 15th through December 7th, because it's going to look a lot different this year. So in that initial coverage phase, you pay up to 25% of co-insurance for your medication covered in your plan's formulary. Your max out-of-pocket, again, is $2,000, and then your plan pays the rest of the medication included in your plan's formulary. And what is a formulary? A formulary is a list of covered prescription drugs that each plan will cover. And again, it's very important to make sure that the plan that you're on, each year, the prescription drug plans or the Medicare Advantage plans, they change their one-year contracts. They may cover your medicine this year, but maybe next year they don't, or again, the plans can be very competitive. and that's why it's important to have that review. Now, if you haven't received it, you should be here in the next few days. Each year, the plan that you're on sends out what they call an annual notice of change. Normally, by this time, individuals have received that, but I'm noticing that this year it's going out a little bit later, and it's starting to hit the mailboxes this week. In that annual notice of change, you'll find the changes that are going to be occurring within your plan. So let's do the plan design comparison from 2024 to 2025. So this year up until December 31st, this is what the plan looks like. And on the top section of the screen, and then we'll compare it to 2025. So in 2024, or this year, the deductible is $545. No one person would have to pay more than that for their annual deductible. In 2025, it is now going to be $590. Once that deductible's met, again, sometimes the plans may say for certain tiers medicine there is no deductible, but once that's, if you have to meet the deductible, that is the most that you would put out in the deductible stage. Once that's met, if it needs to be, then you go to the initial coverage. Some individuals may not even go in that annual deductible depending on the medicines they're on. But if you, you may just go right to that initial coverage. So what's the initial coverage in 2024? It's a copay or co-insurance. And when we talk about co-insurance, that means a percentage of. So sometimes the plans may say you pay 10%, 20%, whatever it may be. So when you see co-insurance, it's a percentage. When it's a copay, it's a direct amount. So a copay or co-insurance is paid for prescription drugs during the initial coverage phase up to $5,030 total drug costs. That's this year. For 2025, for the initial coverage, it is going to be a copay or co-insurance is paid for prescription drugs during the initial coverage phase up to $2,000 in total drug cost. This cap does not apply to out-of-pocket spending on Part B drugs. So it must be drugs that are on your formulary. If you happen to use GoodRx or and purchase your drugs that through GoodRx or a company like them, that will not count towards your initial coverage. The initial coverage only covers those drugs that you put through your prescription drug plan that's on formulary. So in 2024 or this year, the coverage gap, what is that? That's when beneficiaries pay 25% of the cost of generic drugs and 25% of the undiscounted cost of brand name drugs during the coverage gap phase up to $6,000 in true out-of-pocket costs. That's that TROOP that we said we were going to talk about. So TROOP stands for true out-of-pocket cost. This year it's $6,000. And oh, I guess that's why I was using that other thing. Thank you. So $8,000 true for the true out-of-pocket cost. Well, I'm glad everyone's awake. Thank you. So in 2025, the estimated Part D enrolled beneficiaries will no longer face a change in their cost sharing for a given drug when they move from the initial coverage phase. So again, that coverage gap next year will be going away starting January 1st of 2025. In the catastrophic coverage phase, beneficiaries pay 0% this year, and for 2025, they will also pay 0% of their medicine. So, again, Medicare prescription plan, payment plan. We've never had anything like that in the past. So what is that? So the Medicare prescription payment plan is a new program created under the Inflation Reduction Act that offers Part D enrollees the option to pay monthly rather than all at once for their prescriptions at the pharmacy. This program is not in effect now, but begins January 1st of 2025 and will include both standalone Medicare prescription drug plans and the Medicare Advantage plans with prescription drug coverage. The Medicare prescription payment plan will not reduce the amount of money an individual pays in out-of-pocket costs. It will help beneficiaries with high costs by spreading them throughout the plan year. So that may be a benefit for some individuals if it's hard to come up with a lump sum of money that you can, for any given month or 3 months, however you get your medicine. So again, that's a way for you to be able to afford your medicine so that we can all live longer. So eligibility requirements for the Medicare prescription payment, and how do you enroll in that? Enrolling in the Medicare prescription payment is optional, and not all beneficiaries may want to join. So again, it's optional. You may want to continue doing it like you are now and not have a payment plan. Those that will most likely benefit the most will incur a cost of $600 or more for a single prescription at the point of sale. So when you're at the pharmacy, if your prescription is over $600, that's the individuals that will probably benefit the most to go on this payment plan. If an enrollee faces cost sharing of $600 or more for a single covered Part D drug and has not yet opted into the program, the Part D sponsor must notify the pharmacy. The pharmacy will then inform the enrollee about the program and provide the Medicare prescription plan likely to benefit notice. And those who qualify for the plan can opt in or out anytime during the plan year. And my understanding, and it's something that I'll be able to help you with should you want assistance, is you can't just go to the pharmacy and say, I want signed up on the plan, on a payment plan. You would be sent home to sign up on the computer or given a form to fill out. So it's something that's done prior to going to the pharmacy. Those who qualify for the plan can opt out in or out during the plan year. So maybe you did sign up for a prescription payment plan, but that doesn't mean you need to use it. The plan does not cover Part B drugs or medication not listed on the member's plan formulary. So if your prescription medication is costly because it's not on the plan formulary, you will not be able to put that on the payment plan. You'll have to pay out of pocket for that. And once beneficiaries opt into the program, their insurance carrier will distribute their prescription drug costs over the remaining months of the plan year, eliminating the need for payment at the pharmacy. So you won't be making those payments to the pharmacy. You'll be making them to the plan that you're enrolled in for calendar year 2025. Credible coverage went on group coverage. Again, there's times when some of that you may be on your employer group coverage still. So let's talk about how the Inflation Reduction Act is going to impact that this year. So the Inflation Reduction Act of 2022 introduces several cost-reducing measures for Medicare Part D plans, potentially affecting the credible coverage status of employer-sponsored prescription drug plans starting in 2025. And you may say, what's credible coverage? Medicare has the meaning of credible coverage is that the drug plan that your employer plan is offering you has to be as good or better than the Medicare Part D prescription plan, and that's what they call credible coverage. Employers are required to give a notice of credible coverage, which is NOCC, to all Medicare eligible individuals who are applying for or enrolled in the plan. If your coverage is credible for 2024, it will likely be credible for 2025. And this is the first time I'm giving this presentation, but I see that the line that I did miss was I had mentioned about what credible coverage is. So all individuals who are Medicare eligible are required to have prescription drug coverage as good as Medicare or better. If at any point you do not, you are subject to a permanent lifetime penalty. This will now also affect individuals still working at the age of 65 and older who choose to keep their group benefits. So how are we going to prepare for these up and coming changes? You will need an annual review of your prescriptions because of the possible changes to the formularies. So your medicines that you're on now and the plan that you're on now, they may have changed the tiers of your prescriptions. Or they may have taken them off of their formulary for 2025. So please make sure to schedule a time between October 15th and December 7th to review your options. And it's not just this year that you should be reviewing your options. It's been that way ever since the plans have been out. Your Medicare Part D plans and your Medicare Advantage prescription drug plans, as well as your Medicare Advantage plans without prescription drugs, those are really something that you should have an annual review on. Their one-year contracts. And there is beautiful Amanda. And she has done a lot for brokers in the Medicare world. She gets involved down in Washington for us and part of organizations. And she is the one that reached out to CMS, which is Centers for Medicare and Medicaid Services, to get this presentation approved by them. So, questions, concerns?
Here, I have the mic. For anybody who wants to ask a question, I'll bring you the mic.
I have Medicare Part D through Aetna, and without that, I would pay. With that, I pay $71 a month for my prescriptions, but I go through GoodRx, which makes it $31 or something like that. I'm paying $200 a month for this Aetna coverage. Can I just go through GoodRx, or does that?
Oh, you could go through GoodRx, but I would think this year you're going to want to figure out what are the costs of the other medicines and look at what plan would be best for you based on using GoodRx. Or at this point, should you just put everything through the plan. But you're still able to use GoodRx. Amazon, I think, is another program that they have.
But is it in conjunction with the Part D, or is it separate from? Would I get that
It's
same low coverage
It's
if I dropped
separate,
to?
and it will not go towards that 2,000 max out of pocket. So if you find that the medicines that you do take, if through your plan they reach $2,000, you might as well just get them on your plan. Otherwise, now you'll be spending extra money by going to GoodRx. But some individuals, they may find that they want to use GoodRx. Now, you always want to keep that drug plan, or you're going to incur a penalty if you give it up. Does that kind of answer your question? Without knowing what medicine you're on and where you're going to fall within the different plans, that would be hard to answer. But that money that you put out towards to GoodRx, you can still do that, but it's not going to count towards your 2,000 max out of pocket. Not to say it may not be more beneficial to do it that way, but again, you would have to look at all your medicines combined and the cost for your plan. Anyone else? Yes.
Is Medicare sending out books about changes in Medicare?
Yes, every fall, Medicare will send out books for the new year. If you haven't received them, have you received books? I know that
No.
no one's received any books.
No, I have. Well, a few people have.
If you don't receive them by the end of this week, I think I'd be calling Medicare and letting them know.
What number do I call?
1-800
Okay.
Medicare. Does anyone want to? I left my phone in the back of the room, but it's 1-800 Medicare. And if you see me afterwards, I can tell you what the actual numbers are because I have it in my phone.
Well, I get these scam calls that say, "Did you get your Medicare book?"
Okay, let's talk about scams. They're out there. Just be careful. I've seen individuals where talking to individuals, they can put them on plans and without even getting your permission. So be very careful. You're not going to get a call from anyone saying, "Did you get your Medicare book?" That's not that's not Medicare calling asking that.
I've got 12 calls today. Some are the same, some are different. I don't answer them, but they're very persistent.
Okay, so everyone wants those scam calls or those marketing calls to lessen, correct? I think in your packet I have information, and it doesn't just pertain to Medicare, it pertains to scam calls in general. That's the do not call number. Please call that. It's not going to happen overnight that you get less calls. They say it takes about 30 days to go into effect, and hopefully you should see less calls. Let's say once you're on that do not call list, if you're still getting calls, and I think it may say on there, the government does, or FCC does give nonprofits the availability to call you even though you're on the do not call list. However, other individuals should not be calling you. You can report them to FCC, not Medicare. Medicare doesn't handle that. And if they're found guilty, they will get a $10,000 fine, is my understanding. And I would love for you to call because the scams need to stop.
Well, one day, this call was so persistent, I thought, well, I'll just pick it up and not say anything, but let them talk. And they asked me if I got my book, and I said no. And she said, "We want to send you braces." I said, "Braces for what?" "Your knees." "I don't need them." "Don't you have pain?" "No." And she just asked me all kinds of strange questions, and I hung up.
Be very careful. I actually had a client that was on dialysis, and if you know what dialysis is, or don't know what dialysis is, that's when your kidneys failed and you need dialysis. And she didn't change her plan, but she talked to someone, and somehow they changed her plan, and she couldn't go to where she needed to go for her dialysis. But I was able to call Medicare with her and report that she was scammed, and they were able to get her back on her plan. But that needs to stop, and that's why, again, I thank my good friend Amanda Bruton. She's the one that came up and shared those flyers with us that you will see in your packet, because, and she even sits on some of the boards and works with CMS or Medicare to get this stopped.
Do you have a question?
Are you familiar with the Harrisburg program called PaceNet? That if you're, as a couple, you have not more than $41,000 a year income, you get special rates on medications, and I'm wondering if there's anything about that that applies to what you're saying today.
So PACE and PaceNet are great programs, and the individuals that are Pennsylvania residents and you've been here, and I think it's for 90 days that you've been a resident in Pennsylvania. It may be only 60, but I think it's 90. Great programs that a lot of individuals don't know about, and that helps individuals with reducing the cost of their medicine. It is a income-based requirements that you need to meet.
And the amount now is $41,000.
41,500 actually.
Okay.
So they've increased it a little bit. So what does that actually mean? If you have made 41, as a couple, $41,500 or less. No, you're right. I think it's 41. It's the singles that are 31.5. No, they're 33.5. It's 41,000 or 41,500. If your income was under that last year, you are eligible for PaceNet as long as you've been a resident in the Pennsylvania for 60 or 90 days. It is a simple call to PACE and PaceNet. They call it PACE, but they have a PaceNet program. And I can help you with that also, making that phone call, or I can stop back and see me at the back. I'll give you the telephone number. Now let's talk about for those that are single. The income limit is $33,500 for PaceNet. You cannot make more than that prior year, so we would be looking this year, we'd be looking at 2023 income for PACE or PaceNet. They do not count your resources. That's one of the plans that one of the programs that I know that does not count resources, so that does not go into play. If you're currently paying more than, if you get accepted for PaceNet, you will not pay more than $15 for a brand drug as long as it's on your Part D formulary or on their formulary. And then the individuals that are eligible for PACE, I don't have those numbers memorized, but that would be a lower income, and then you would be paying lower, for a brand drug, you would be paying lower than $15. That's a little bit about the program, but keep sharing that program. It's a great program.
Is there anything about what you're doing today that applies to that?
Oh, that was your original question. I'm sorry, I got off track there. So I have to reach out to PaceNet and PACE to see what's going to change. I haven't heard that there is, but I need to reach out to my PACE contacts and find out.
So the PACE
So a couple benefits of PACE and PaceNet. If you're not happy with your plan, you can change your plan one time a year. Also, they may pay your deductible for you. Are you familiar with the plan? The gentleman in the...
No, I'm just asking, if my mom pays for drugs through PaceNet, does that go towards the Medicare deductible also, an out-of-pocket max or not?
PaceNet may pay that deductible when you're on that plan. That is how it has occurred in the past. But you have my number. I am, the annual enrollment periods from October 15th through December 7th, and that's one of the things that I need to find out is how PACE and PaceNet are going to work in conjunction with this, but I haven't heard anything as of yet, so I would think that they would keep working the same way.
Are there other questions?
Yes, here we have one in the front row.
Spin in circles.
I don't know that I have a question, but I will put a thought out there. We got our Aetna 2025 information, and our premiums will be going from $10 a month to $45 a month, okay, to get everybody under the $2,000 deductible.
Yes, we may see some increases from the company. We may, so how is all this going to work? We may see some increases on your... So that's why it's good to see what else is out there. And just, but I think we're all going to have to chip in to, and this is just my personal opinion, is to help cover that $2,000 so no one person has to pay less than that $2,000. So we may see some increases this year. And so I'm not allowed to talk about plans and prices. I just can keep it educational at this time, but feel free, you have my number to reach out to me should you want to speak with someone, and I will be working here on campus.
Any other questions? Okay, well, if we don't have any other questions for the group, maybe I'll give you a moment to get to the back of the chapel before everybody stands up.
Okay, and I'm glad that you felt it's important to come out to, because you need to know what's going on, and I hope that things work out well for everyone this year. And again, thanks for coming out today. And you live at a lovely place, lovely community.
Okay, thank you, Liz. Let's give her a round of applause. And again, she's going to be at the back of the chapel if you have more specific questions for her. Also, if you were not able to get handouts when you came in, she will have more handouts available at the back. Okay, thank you all so much for coming. Have a wonderful afternoon.